Aren't rolling. Okay, take it away.
Can I come in?
Yeah, you can.
Hi, Mrs. Wall. How are you doing today?
I'm good.
I'm Kristen. I'm a student nurse. I'm coming in to see how you're doing and see if I can do some oral care with you. Are you feeling okay right now?
Yeah, sure. Brush my teeth.
You're okay. I can brush your teeth?
Yep.
Okay, and do you know how to brush them yourself?
Nope.
Okay, let me just wash my hands here.
Okay.
Okay, and I've already assembled everything prior to coming into the room. And I have everything that I'm going to need for the process. And I come in and could you go ahead? I'm looking at the order here and it looks like you're due for oral care daily. And can you just verify your birth date for me, please?
12/25/88.
Okay, and that's a match. And let me look at your wristband. Okay, looks great. And I'm going to come over here. So everything's been going on okay in your mouth? There's no sores or any discomfort?
Nope.
Okay, great. So all of your teeth, let me just have a quick look. And are all of these teeth natural? You don't have any dentures or anything in right now, is that correct?
Nope.
Okay, great. So I'm just going to put some of this toothpaste that we use here on this toothbrush. Okay, just a little tiny dab, not like they do in the commercials. Okay, and getting it wet is really not recommended for brushing teeth. So I have a little bit of lukewarm water here for you to rinse when I'm done. I've already tested to make sure it's not too hot. Okay, so I'm going to just start now with the paste is on here. And I'm just going to start at a 45-degree angle and I'm going to brush up here. And I'm going to spend about 30 seconds on each area, 15 on the underside, 15 on the outside. And due to redundancy, I'm not going to make you guys sit here for 2 minutes, but that would be ideal to brush that way. And I'm just going to want to brush to the crowns. And while I'm doing so, I'm kind of noticing and I'm asking you, are you okay? Just let me know. You can raise a hand if you want to spit and I'll just put this right here. Okay, great. And just take your time and let me know. Don't swallow any if you can avoid that. And I've got my suction equipment here just in case. And can you, now that I've spent the 2 minutes, stick out your tongue for me, please? And I'm just going to brush the tongue a little bit here, being careful to try not to gag the patient and ready just in case I do, and not disrupting the base taste buds. And now that we're done, I'm going to give you a little bit of water for you to rinse. Okay. And would you like any more water? I want you to really get it all out of your mouth.
Okay, one more.
Okay. Okay, great. And I'm kind of just noting everything that's coming out. It looks pretty clear, so kind of is a good indication to me that she's getting her teeth and oral care done as she should be daily. And now I'm going to do a little inspection if that's okay. I just kind of want to check everything out.
Okay.
Okay. Meanwhile, I had my gloves on the whole time. And
towel around her teeth. He can hear you.
Well, you said something.
Just keep rolling.
okay. And this is optional. If you think that the patient might spit up, then you may have that. Or if the patient's infected with something, then you're going to follow the precautions. So I probably should have had this towel here because that would be helpful in case any dribbles out. Also, just as a side note, I would not be wanting to use any type of paste if the patient was comatose or unable to spit. So now I'm just going to go ahead and check your mouth out, okay? And let's see. And I'm looking just at all the corners, and I'm just going to go ahead and look in here using my gloved hand. And I'm looking for cavities, sores, thrush. Can you lift up your tongue for me? And let me look underneath and at the throat, and everything seems to be pretty normal. I'm not seeing any decay. I don't really pick up any odor. And so all that's looking really good to me.
So I'm going to live?
So you're going to live.
Oh, good.
From your toothbrushing experience.
Good, thanks.
And, you know, upon leaving the room, is there anything else that I can do for you?
No, I think that's it.
Okay, and I'm going to lower the bed, and I'm going to put the call light here, and I'm going to ask you if you need anything, and you don't. And I'm going to go ahead and wrap everything up here. I'm going to wash my hands and check the room. Looks like everything's safe. You're not going to trip on anything. And I'm going to head out.
Thanks,
Okay.
Kristen.
You're welcome.